Welcome to All Things Chiropractic.
Welcome to another episode of All Things Chiropractic. I'm Paul Andrews.
I'm Dr. Mark Davini.
So what's today's title, Doc?
The title today is Chiropractic Mixology.
Ooh, I'll take a double on the rocks, please. Thank you very much.
Okay. I like it.
So what are we talking about when we're talking about chiropractic straight versus mixer?
I am so glad you brought that up because let's face it, we're resurrecting a couple old terms, but they may be old terms, but they have very, very current meanings, at least in the world of chiropractic today. I think one of our biggest problems, which we have even discussed before in a previous podcast about subluxation itself, is that we put out way too many mixed messages to our patients. And it's very hard for our patients to understand what chiropractic is when we as a profession have a difficult time defining it ourselves. So we're going to resurrect this old conversation and use it to make the point about the fact that there's an awful lot of differences among us, and that's not helping the cause.
It's funny because when I first started in the chiropractic profession as a CA, and I heard this term from my boss, the doctor, I was like, what are you talking about? And he was like, well, not everyone, it's really a clinical approach we're talking about because not every chiropractor treats the same way. And I was like, in my naivete, I was like, what are you talking about? It's chiropractic.
That makes no sense.
Yeah. Doesn't everybody do everything that you do? And he said, no. And, he gave me a little bit of his history. He started out more in that straight clinical approach and moved on to the mixer approach. But I was, again, naive and shocked because, you go to the doctor and you get a physical exam. It's pretty much the same thing every time you go to any MD, right? You're going to get pretty much the same exam.
Oh, absolutely. And that's part of the problem is that if you were to get two chiropractic patients together, both of them seeing different chiropractors, they're not going to be describing the same experience. So it's hard for us as a profession to move in the direction we need to go to when, as a profession, we have no cohesive thought about who and what we are and what we do and how we do it. So it's time to just recognize that we do have our differences, and that's always good. And we want to promote our uniqueness. That's also very good. But we also have to have respect for the fact that these differences cause confusion.
So before we get into what is a straight clinical approach in chiropractic versus mixer, I just had a thought, and I don't know if you can answer this, but do you think that the newer graduates coming out of school even know this, or is this a thing?
No, I that's why we say we're resurrecting an old concept. And when we say resurrect, we mean really resurrect, because there's probably a vast majority of the docs graduating that have never even considered this as a discussion. Where I can say that during my years in chiropractic school, it was a huge discussion point and had to be one of those things you made a decision on, both during your time as a student and when you graduated and decided to open a practice. What am I going to do? How am I going to do it? What am I going to use? What am I not going to use? What do I say to my patients? All of these things mattered, and they still matter now. The biggest problem is that that if you're coming out of school and you don't understand this concept, then you're not going to be able to articulate to your patient why you do what you do, as opposed to why someone else does something different from you.
So to sort of like think about the end in mind, in a sense, in this conversation, it's about giving that patient the enlightenment that what you do isn't what every chiropractor does. Here's why you do what you do. And if you were to, refer somebody, this is what to expect versus what they maybe have gotten elsewhere.
Exactly. That's a big part of it. When you look at it and you say, I want the chiropractor to also understand some of the we'll say differences. And when they make a choice to do something in their office. It's a conscious, educated, intellectual choice, not just taking something for granted or, in a sense, not even knowing there are different options and different versions of things out there, except for what you think you do or what you were just taught in your school. Because of, I believe there's like 19, 20 different chiropractic schools. It ranges from one school not even allowing you to use the word subluxation all the way up to other schools where, subluxation is worshipped. So where do you fall in that continuum? And do you even understand that there's a continuum there? And if you do, then the choices you make are based upon your education, your experience, your belief, and hopefully making it an intellectual choice.
So let's dig into the mystery.
You want the straight scoop?
Yeah. What's the straight scoop on a chiropractor whose clinical approach is straight, so to speak?
Right. Well, let's at least back up one step and say, what are the commonalities? And then we can say, once we identify the commonalities, we'll be able to know the differences and why we approach things differently. But for discussion purposes, let's say that we all understand that we treat subluxations. And if that's something that you have a hard time with, using that term, please listen to our other podcast on subluxation. But we all treat subluxations, and we can recognize that there are components of that subluxation. In general, we understand that there are basically 5 components of subluxation. You can have hard and soft tissue components like joint fixation and muscle spasm. You can have neurological components where there is some type of compressive lesion or facilitative lesion. And you can have wear and tear of both hard and soft tissue like degeneration or adhesions. So these are all the components of a subluxation. Understanding that, what would a straight do as opposed to a mixer? Well, again, recognizing that the adjustment, the chiropractic adjustment, addresses all 5. That's what we do. We're chiropractors. We adjust the spine in order to enhance or improve every one of those 5 components. If we were a straight chiropractor, that would be it. It would generally end there as far as what we do in office. That doesn't mean that we wouldn't recommend exercise or proper nutrition or whatever. But we wouldn't be doing too much more in our office other than adjust the spine. And the old saying was that the body doesn't need any help; it just doesn't need any interference. And obviously, the belief system behind all that is remove the interference by adjusting the subluxation and let the body heal itself. It's truly a holistic approach. Do what the body...
So what you're trying to say is, if I unkink a garden hose that has water in it, I don't need to massage the hose after. The water will flow.
That's about right.
But the massage feels good.
But the massage feels good. And that's not to say that there aren't limitations of matter that might need other forms of interference. We might have reached that point where the body can't heal one of those components well enough. So with that in mind, somebody might go forward and say, I'm going to adjust, I'm going to adjust, I'm going to adjust. I want your body to heal. Oh, please heal, please, please, please heal. And it doesn't heal enough because maybe the adjustment isn't all that body needs to get past the point that it has degenerated to. Let's face it, we have people that you catch early enough and you can impact them dramatically as far as their structure goes. And then we have people that are down the road a bit.
Like, I don't know.
Down the road a bit.
Someone who went to school by candlelight only.
That's it. Back in the day by the fire, actually. Yeah. And so you go down the road a bit and all of a sudden there's so much wear and tear that maybe the adjustment alone wouldn't be enough to handle that one particular component. And what if that one particular component was the cause of your symptom, which generally is one of the main reasons that drive patients into your office? So there's a lot to be said for being philosophically a straight chiropractor. where I want to just remove the interference and let the body heal itself. Well, I can tell you right now, just from personal experience, my body healed a lot faster at 20 than it does at 69.
Yeah, like I'm experiencing right now.
You mean your symptom is 20 years old? Yeah.
Hey, listen. So do you think that a very strict, philosophically straight chiropractor would agree with anything you just said about needing more than the adjustment?
You know, in the older days, they were more philosophically dogmatic. Not so much today, because I think in the old days, there was this, still is, she's alive, Pat Karn was a clinical assistant for famous acupuncturist. And she wrote an article once that said, what happened to all the miracles? And the article went on to expound upon the fact that in the old days, people came in with just subluxations. Life was simpler. Everything was simpler. The air was cleaner. The food was better. Life was better, all of that. So they'd come in and remember, like we talked about in one of our other podcasts about patients had already been to other practitioners. So the subluxation was really already, in a sense, weaned out of, and I mean, all the other options were taken away, and that the subluxation was really what was left behind. So when they came in, you adjusted them and miracles happened like immediately. Now, what she said was, and this article's like 25 years ago, but the article said, now there's subluxation complexes. Life is just way more complicated. So there's no more just a little hitching to get along. People are coming to you first. People have more complicated issues that impact the subluxation itself, which means that just adjusting the subluxation may not be enough. So that's why we bring in other things. Maybe it might be as simple as lifestyle advice, or get more rest, do some exercise, eat a little better, all those things. Or we might even go so far as to add a modality or some form of therapeutic procedure.
So that gets us into the definition of a mixer chiropractor, right?
Exactly.
They're mixing it up a little bit.
So it's not so straightforward. Okay. So the mixer might be someone who does adjust, hopefully, does adjust.
Wait, would a chiropractor just not adjust? Is that what you're saying? In the mixer world?
The chiropractic adjustment is losing its prominence as the primary procedure we do in chiropractic, and unfortunately gets confused with being one of the things we do as a chiropractor.
Correct me if I'm wrong. If I'm a surgeon who doesn't do surgery, am I still a surgeon?
Good question.
I'm just asking.
What's chicken or the egg, right?
Listen.
There's actually a number of schools that would teach the premise that the chiropractic adjustment is just one of the modalities that are being taught, not the primary procedure that's performed by a chiropractor. And if we do choose or option to do other things, those would be supportive to that primary procedure or secondary. So there's still schools that teach that the adjustment is the be-all, end-all, of course. And if you do choose to do things from as simple as nutritional advice or exercise advice all the way down to decompression and laser, you're still putting the primary importance on the adjustment. But it's eroding slowly, where the chiropractors themselves are not necessarily putting the importance on the adjustment. So if you were in the mixer world, to use that term, right? If you were in the mixer world where you do adjustments and you may do other modalities and therapeutic procedures, like you might do electrical stimulation, you might do therapeutic exercise, you might do manual therapies like ART or things like that, where there's something that the patient will experience in addition to the adjustment. It's critical in the chiropractic world today to make patients understand that the adjustment is what we do as chiropractors, that the adjustment is what makes us unique and different from all other professions. And if we don't emphasize that in our office, especially if we're doing other modalities, and other therapeutic procedures, then it gets a little foggy and lost.
Yeah, but as a non-chiropractor, I'm going in as a patient. I'm thinking my mindset, at least mine would be, well, if I've got a problem, I want you to hit it with all barrels, whatever you got. And also, some of those modalities, like, they make me feel better. So,
Absolutely. And like I say, sometimes there's a limitation of matter and you have to do other things. Sometimes you choose to do other things because maybe it will move the symptom picture along a little more quickly. Nothing wrong with all of that. What I'm saying is that there is a primary reason why that person is going to the chiropractor over other practitioners like physical therapists or massage therapists or even their medical doctors. The whole point is they have to get something that's different. Everything else can be obtained by other professionals. Why am I going to go to a chiropractor to get manual therapy? Why am I going to a chiropractor to get therapeutic exercise? I can go to physical therapist and get both of those and more than likely have it covered better through my insurance than chiropractic in the world today. So why am I going to go to a chiropractor? And that's what we're saying is I don't care whether you're, quote, a straight or a mixer. You can add in anything you want. You can have them stand on their head if you want. B.J. Palmer used to say, hit them in the butt with a shovel. They're still going to respond. But they should know why you're...
Isn't that how you practice for like the first 10 years?
I actually used yes. I used a square shovel, so I wanted to make sure I got everything.
Yeah.
But that's what I mean. It comes out to be that you have to make sure that your message is clear. The adjustment is what makes you better. And the other stuff is supporting the adjustment. But the other stuff isn't what I do that makes me different. I always used to have a practice in my when I practiced. I had a procedure in my practice that, and I did a few other modality things too, just like everybody. They were helpful, but I would never introduce anything other than the adjustment until the very first time till after the first time the patient came in and said, "I feel better." Because I wanted them to understand that it's the adjustment that was making them feel better.
So what would you add in after that?
Well, say if they did have some kind of muscle tension or hypertonicity, maybe I'd throw an electrical stim after that. But it would never happen until...
And how many times did they say to you, well, if you had done this in the beginning, I would have felt better sooner, doc?
Well, but they've already told me they're feeling better.
Yeah, but I mean... When they're like, oh, that feels good. Why didn't you do that when we first started, right?
Yeah, and I just simply say to them, because the adjustment is what makes you better, this will just support it and help it along. Maybe faster, maybe not. But the whole point is, like you say, people want to get everything they can get to get better as quickly as they can. But you also have to know that your clinical approach is working. And part of it is maybe if they weren't getting better through adjustments, why are they in my office? See, I was of the belief that if the adjustment wasn't helping them, I'd rather send them to somebody else to get the other stuff alone without the adjustment. Because number one, it's what they went to school for. They were better at it than I was. So if they came to my office, what they were going to get that was better than anybody else was the adjustment. And all the other stuff was just supportive to that.
So I'm a claims guy. I'm a billing person. So I'm going to go down this road a little bit, but in a delicate way. First, how would you say the majority of chiropractors in the nation are mixers versus straight?
Absolutely. Yeah.
Now, I'm not going to say that there's a financial incentive to be that way. However, when you provide more services on a visit, you tend to get more reimbursement or payment, whether it's from the patient or the insurance carrier, for that visit. Don't you?
Oh, absolutely.
See how I did that in a very, very subtle, not
very
real subtle,
subtle.
not real subtle way, but
yeah. And again, you should do whatever you think is necessary to get that patient out of pain as quickly as possible, if that were their complaint. And then also to correct the problem as completely as possible.
Well, you hit it right on the head there, Doc, right? Because when they get out of pain, they think they're better. And if you didn't do a great job of educating that patient along the way that pain's the first thing to come and the first thing to go, but you're not better just because you feel better, right? If the doctor's not giving them that education, then they're out the door and we'll see you the next time we hurt, right?
Right. And so to get back to your point, if even though you might have done more services up front, they're terminating their care earlier than they should.
Did I talk myself out of my own point? Oh, jeez.
But I'm saying they might leave your care sooner before the situation is as corrected as you can make it. So it comes out to be, there was that old commercial, pay me now or pay me later. Right. So are you going
I'm sorry, I'm too young. I don't know what you're talking about.
Are you going to be a catch and release doctor, or are you going to be a wellness doctor? So obviously, if you're a wellness doctor, you want to bring them to the maximum improvement that you can get them, and then you want to keep them there. And by that point in time, you are doing less things as far as treatment goes. You're doing mostly just adjustments by that point in time. And then they become wellness patients, and they come in regular, and they're only getting adjustments most of the time. Or they're quitting because you failed to make them understand that regardless of your symptoms, I am here to make your spine as well as it can possibly be and to remodel your brain, which is all the new research now showing that the adjustments help remodel the functions of the brain and rewire the circuitry.
Boy, that explains you quite a bit, doesn't it?
Doesn't it? Yep. I get adjusted a lot. My brain is all rewired.
So how would you handle somebody, a new patient coming in, right? And they're like, hey, I don't understand why you're not putting that electric stuff on me, or that, why am I not sitting on this bed that rolls something across my spine? Like, how do you deal with that?
Again, you have to start from the beginning, and you have to always be about what it is that you are and what it is that makes you unique. Well, number one, you're a chiropractor. And number two, what makes you unique is you adjust the spine, and no other professional adjusts the spine. No other professional. Others may do joint mobilization. Others may do tissue manipulation. Others may do exercise therapy or manual therapies of all kind. But we are the only ones that adjust the spine. And if you're unclear with that message, then of course they're going to be confused. And when they go talk to their friends and they are all going to different chiropractors and they're all comparing notes and they find out everybody's doing something different, what you really want that group to sit around and say is, but the thing that really matters most is I'm getting adjusted. Because without the adjustment, then why am I in a chiropractor's office to begin with? So yes, it gets to be more, in a sense, a more difficult path to explain things like modalities and therapeutic procedures, because sometimes they take more time, a lot more time than an adjustment. So patients might have this perception that that's what's getting them well.
So someone comes in, right? And whether you're, I guess, straight or a mixer chiropractor, and they are, don't touch my neck. I've heard things about people getting hurt. I'm scared. And you're focusing on the adjustment as the primary procedure and all the things you just said, which are wonderful. That's a challenge, right?
Well, it is, and it isn't, because in my office, there was a very simple solution. I didn't accept them as a patient. I don't treat necks. I didn't treat low backs. I didn't treat mid backs. I treated the spine. My technique required that I treated the spine. Wherever the subluxation revealed itself and needed attention, that's where I treated the patient. That's where I adjusted. If somebody comes in and says, I want you to only adjust my low back because that's only where the pain is, and the first question I ask is, you work for Medicare? But if they stop putting that kind of limitations on me, it would be like, again, using your surgeon as an example, walking up and saying, I really don't want a scar bigger than 3 inches. But you have an open heart surgery. I know, but I still don't want the scar bigger than 3 inches. So, just don't make the scar bigger than 3 inches. And when you start putting that kind of limitations on what you do and why you do it, then you are not really adjusting the subluxation per se, because the subluxation is a spine-related condition. You might be adjusting fixations, you might be adjusting adhesions, you might be adjusting local problems that aren't necessarily we'll say specific to just chiropractic. But for those problems that are subluxation based, and a patient came and said, I don't want you doing, adjustments to my neck, and I'd have to say, well, then I'm not the chiropractor for you. You have to have the chutzpah to let a patient walk out of your office because they're not following what you need. You're the doctor, not them.
Well, it's funny because with all of the resources and the wealth of information, both good and bad out there, patients are more proactive, aren't they, about their care, and the more directive with their providers about their care. So there is not a challenge, but there is an aspect to practice that's, more prevalent than it used to be, right? I mean,
absolutely. And you'll hear it throughout all of our podcasts. If I'm rambling on,
I try to focus on people.
I know. But it's education, education, education. People have to know what you do and why you do it and how you're going to do it. And maybe sometimes there are alternatives to the way that you do it that can be acceptable to the patient and that you're willing to accept also. But sooner or later, there might be that point of time where you say, we have to part ways.
So we know now that the straight chiropractic approach is basically adjustment only, and the mixer includes adjustments with supportive procedures. And it sounds like sometimes that can get a little cloudy with the mixer chiropractors because they might put a lot of emphasis on the supportive procedures versus the adjustment.
Absolutely. I mean, probably one of the things that's out there right now that's very popular and I believe very effective is decompression. And now, I'm a lover of traction. When I got my diplomat in neurology, I did my thesis on traction. I am a traction guy. Okay, I love it. I always hoping it would make me taller, but it never did.
You keep trying, buddy.
I keep trying. Right? Now it's just stopping me from getting shorter, right? Yeah. But I love traction. But there are those out there that have incorporated decompression into their practices and are, in a sense, utilizing it outside of their chiropractic practice. So sometimes I might ask the question, is it possible for a patient to come in and get decompression and not be adjusted? And most of the time the answer is no. That most chiropractors recognize that traction is a supportive procedure.
Anything's possible.
But anything's possible.
Right. Anything's possible.
And if you do that, then you're doing the same thing the physical therapist does when they incorporate decompression.
Well, coming from a regulatory background too, I'm saying to myself, depending on the state that you practice in, that might be a problem, right? Not adjusting.
God, yeah. I mean, that's a whole can of worms itself. But yeah, I agree. So it comes down to very simple discussion here that know who you are, know what you do, know why you do something and why you would not do something, and make sure your patients understand that. Then none of this is an issue. They'll appreciate your uniqueness. They will promote your uniqueness. And you'll be happy you did. You'll be practicing more congruent with your belief system.
It kind of sounds like the message we give a lot, which is, well, with this particular topic, it isn't that one is better than the other. It's just about you, doctors, embracing whatever identity you are, how you practice, and giving that education to your patients so they understand that what you're doing is special for them, and that just because they might feel a little bit better doesn't mean they're better.
Right. Unless you're a symptom-based practice, which those do make decisions to be just symptom-based. But the bottom line here is chiropractic is more than just relieving symptoms. Good bottle of aspirin might do the same thing, and a lot cheaper with a lot less effort.
Well, there's the laws of attraction, right? If I want to be a symptom-based practice, I'm probably going to be seeing a lot of people in pain. If I want to be a wellness maintenance practice, then I want to attract those people, and those who just want to get out of pain probably won't stay long at the office, really. Right?
It's your message. You get to say it any way you want. What's that for?
Oh, I like that. Look at you.
It's your message. You get to say it any way you want.
Exactly.
Just don't be upset if they don't get the message if you didn't say it well.
And that's okay. rejection isn't really rejection. It's just finding the best fit for you and for your patient, et cetera, right?
It's a way to learn.
I like it. All right. Well, thank you. This was enlightening, as always. Thank you for joining us for another episode of All Things Chiropractic. I'm Paul Andrews.
And I'm Dr. Mark Davini. Thank you all.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. Or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.